Sorry, I can't smile very well. Today is March 27th, 2018. Today is the 10th anniversary that Gabapentin caused my movement disorder after only taking 2 consecutive doses of Gabapentin, which is the generic for Neurontin. There is one consistent thought in my medical records. I'm quoting from 2012 from a movement disorder specialist. While gabapentin is associated with dystonic reactions, these have been reported in the setting of chronic use and resolved when the medication is discontinued. The first doctor that was supposed to give my MRI results to me told me, "Your MRI results aren't in yet, but I'm sure you didn't have a stroke." I went along with him because I had never heard of a stroke that could cause a movement disorder. I found a sign in a hospital and I took a picture of it. The signs of stroke: think and act fast. Each letter stands for what to look for. Face: ask the person to smile. Does one side of the face droop? Arms: ask the person to raise both arms. Does one arm drift downwards? Speech: ask the person to say something. Is the speech slurred or garbled? Time: if you notice any of these symptoms, call 911 immediately. Well, I found much later that there is a stroke that causes twitching and jerking. It's called infarction, affecting the subthalamic nucleus or its connections. During the onset of my movement disorder on the first day, I saw an aura, seeing bright dots of light, rapid hand shaking, arm punching, shaking legs, loss of balance, shoulder shrugging, chattering teeth, uncontrollable laughing, which is gelastic seizures. My doctor was notified, and he had the nurse contact me and say, side effects always wear off. Well, they don't. I don't know if you can see that, but I added one thing to it. Pfizer bought out the company Parke-Davis, which were the original makers of gabapentin, which was first called Neurontin. And they would like you to know, especially doctors, what Neurontin can do, and it's called Neurontin Gabapentin, Pfizer Medical Information, U.S., and it was published on November 7th, 2016, and it's approved by the FDA. So these are things that doctors need to know about. There's a lot of them. That the most common side effects of Neurontin include lack of coordination, viral infection, feeling drowsy, nausea and vomiting, difficulty with speaking, tremor, swelling, usually of the legs and feet, feeling tired, fever, jerky movements, difficulty with coordination, double vision, unusual eye movements. I don't know if you can see my eye movements, but they're not normal. They kind of shudder. I have a Spock eyebrow too. And when I close my eyes, they keep on trying to blink. It's hard to go to sleep when they're blinking. And they also admit that under nervous system disorders, that it causes movement disorders. I've also found people online on patient info. They have many questions, but this one is, anyone else having issues with uncontrollable eye movement with gabapentin? I found one lady recently. Her name is Elise, E-L-E-A-S-E, and she only took it about 2 weeks, and she has dystonia really bad, and she has attacks every day, and her husband took her to the hospital one day when it was going on for hours, and he took a picture of a video of her and posted it. It says Elise Dystonia Storm, and it's really hard to watch, but she goes through this every day, and it's been over 6 months. And I wanted to know how people were told to start it, because I was told to start it 1 capsule 3 times a day. But that's not for people that don't have epilepsy. They said in the information for doctors, day 1, a single dose of 300, day 2, 300 milligrams, 2 times a day, and then on day 3, 300 milligrams. I found this under Neurontin, Gabapentin, Pfizer Medical Information -US. I did not click it, it just printed it. Anyway, one woman said that well, I'll just put it the way she said it. I was put on this evil drug, gabapentin, for crushing headaches. I went through hell. My doctor had me take 1 300 milligrams for 3 days, and then 2 milligrams for 3 days, then 4 300 milligrams the rest of the course. I only got to 900 milligrams, and all hell broke loose. Got every side effect there is. I weaned off how doctor told me. Now the withdrawals are horrible. The only thing I don't have is the eye movement, only blurry vision. Now I still have that plus crusty junk in my eyes. Never will I take this drug again. As far as dosage goes, I don't think doctors really know. I told her my doctor who prescribed gabapentin was informed within an hour after my uncontrollable movements began. The nurse called back and said side effects always wear off. That night my shoulders started nonstop shrugging, and then my head started moving back and forth like I was saying no. I knew it wasn't wearing off. The following day was Saturday, so I called our son that lived nearby and asked him and his wife to come see what happened to me. My daughter-in-law took one look and started crying. When she saw my staggering gait, she offered to come help me with cooking and cleaning, and I even needed help showering. It was a living hell, going from being independent to needing someone to assist me. Then she decided to take me to her house to live with her, which only lasted 17 days because she sent me to bed at 8:30 p.m. When my husband brought me home for our anniversary, I asked him to buy me a lightweight vacuum cleaner. I could only vacuum during a TV commercial. Then I had to rest. My blood pressure was over 200 and hadn't ever been that high before. It was a wonder I didn't drop dead. I was 59 years old when this happened, now 69. Little did I know that my doctor decided to turn my condition into a psychological problem instead of telling other doctors what really happened to me. Doctors wouldn't inform me. My brain MRI showed that I had a 5 millimeter lesion on my hypothalamus gland, at the entrance of the pituitary stalk. Diane answers, "That is just crazy. I swear these doctors don't know what this med can do. I told my doctor what I was going through, and she said she didn't know why I felt so bad. Gabapentin was the only new bed I was on. I told her that GABA ruined my life. She tried to tell me I should just stick with it. Well, there was no way in hell I was going to. You're right, I can't believe I'm not dead from this. I cried all the time, felt like all my muscles in my legs were gone. Talked stupid, chills, hot flashes. I'm wondering what can be done, so doctors have to tell you exactly what could happen, and a lot of times does happen. No doctor wants to admit it is the gabapentin. I'm glad you got through this, and sorry so many of us have to suffer. By the way, I'm the same age as you were when you went through this. I told my husband if I can't speak for myself, he better not let them ever put this evil drug in my body again. Thanks for sharing your story. Hopefully all of us telling our stories can help." And I found online a doctor who was answering a question about what causes uncontrollable twitching and jerking. And the writer is J. Cottle, MD. Okay, this is known as bullismus and can arise for a variety of reasons, and although it can rarely affect both sides of the body, typically it is limited to one side only and known more properly in cases as hemibullismus. A common cause is a lesion at or near the subthalamic nucleus in the brain, but if you've undergone MRI with contrast, then it's unlikely to be the culprit here. My suggestion would be to obtain a reevaluation by a neurologist and make certain that conditions such as lesion or Creutzfeldt-Jacobs disease have been ruled out. Well, I didn't get that kind of a diagnosis. You see, I recently had an EEG and a surface EMG with video monitoring, and I was asked to sign to give them permission to use it to teach other doctors. Well, towards the end of the test, they decided to tell me to stand up. And when I did, well, the weight of, I think it was 60 wire leads attached to me. They were drug over to one side of my body, and I had trouble balancing. And so the nice lady, she held one arm and helped steady me. Well, because of the fact that I had some unsteadiness while standing, I got the diagnosis orthostatic tremors. Nothing about the jerking, just tremors. I actually joined a group, a support group for orthostatic tremors, and people can only stand maybe